Welcome back, everyone, to another episode of ZIZ's HealthWise. I'm your host, Clilia Davis. I'm a medical scientist, and today on the panel we have registered nurse Miss Cindy Anslyn. Good evening.
Hi, good evening.
How are you doing?
I'm doing great. How are you?
Good, I'm doing good.
Perfect.
Awesome. So this evening we're going to have a packed show, and the topic this evening is going to be sickle cell, science, medicine, and beyond. So those persons who may have heard the term sickle cell before, maybe sparingly, or there are some persons who are actually going through the different crises associated with sickle cell. We're going to dive into all of those different things and really bring a much greater awareness to what sickle cell disease actually is. And also in this evening show, we're going to be highlighting our medical personality and also taking a look at what is happening at the JNF General Hospital in the medical bulletin. So we'll take a short commercial break and then we'll get the show started for you guys. Thanks for tuning in.
The dangers of sweet beverages in the Caribbean. It is time to shine a light on the dangers of sugary beverages. Sugar-sweetened beverages are the main source of sugar in our diets, and eating and drinking too much sugar has been linked to being overweight and obese. In St. Kitts and Nevis, 50% of adult females and 37% of males are overweight and obese. And 28% of children are either overweight or obese. A survey showed that 62% of students between the ages of 13 and 15 drank one or more carbonated sugar-sweetened beverage every day, exceeding their daily healthy limit. So, how much sugar should we consume? The World Health Organization and American Heart Association recommends that children aged 2 to 18 should consume less than 25 grams of sugar daily, and adults should consume less than 50 grams of sugar daily. It will surprise you how much sugar is in some of your favorite beverages. This chart shows that on average, one serving of a sugary beverage exceeds the daily maximum sugar intake for children, which is 25 grams, and is very close or sometimes over the limit for adults at 50 grams. The impact of sweet beverages on your health, your family, and community can be severe. So, it's time to rethink your drink. This message has been brought to you by the St. Kitts and Nevis Ministry of Health.
A pleasant good evening again, everyone. My name is Clilia Davis, your host for this evening. And if you're just joining us, we're going to be speaking about sickle cell disease this evening. So, as mentioned, I have nurse Cindy Anslyn here with us this evening. And I just want to make note that even though today is June 30th, June 19th was World Sickle Cell Day, and the theme this year was Global Action, Local Impact, Empowering Communities for Effective Self-Advocacy. So the theme of awareness and advocacy is going to be reigning supreme this evening in our conversation. And so we really want to highlight that so you have some context for this evening's show. So let's get straight into it, nurse. Can you tell us what sickle cell disease actually is?
Okay, so basically, sickle cell disease, it affects the red blood cells. In the body. Basically, red blood cells, they carry oxygen to various parts of the body. And in sickle cell, sickle cell anemia, the blood cells, they are crescent shaped. They have a sickle shape, so they have like a C. It looks like a C. And so because of this now, they're not able to carry the hemoglobin to the various parts of the body. And so you find that most times the oxygen is limited to various parts of the body. And now what happens is that you find that persons, they become more fatigued, they're tired, and then we have this thing where they have a vaso-occlusive crisis. So basically, they're always in pain. and they're mostly always in pain because the biconcave, no, not the biconcave shape, the sickle shape,
The crescent shape.
the crescent shape. What happens is that most of them, they stick, they clump up together, and so you find that they get stuck to the walls of the vessels, and then our blood cannot flow to these areas.
Gotcha.
And so they have intense pain, they have joint pain. It's very awful.
And is that the reason why we would say sickle cell anemia? Because anemia is maybe one of those manifestations due to the lack of functional red blood cells. Okay, so also just to give our viewing and listening audience some context, I would have done a lot of extensive research in sickle cells, so I would also be supplementing nurses' answers today. So it's really going to be an interesting conversation. So you mentioned the vaso-occlusive crises, and for those persons who may not know exactly what that very long word means, is it something where we can see the cells, the red blood cells, sticking to each other?
Correct.
Also, as you mentioned, the walls of or the epithelial walls of the blood cells, the blood vessels, and also to other blood cells. So as a result of that, now, particularly in joint areas, that is going to have some manifestation of the sickle cell crisis.
Because no oxygen is being able to reach there, and if the vessels are blocked up, now you're looking at nutrients are not being able to go to these joints, these organs, and so you find that they're not able to function.
Right. And in terms of the anemia now, because the red blood cell, a normal red blood cell would have on average maybe a 90 to 120 day lifespan. With a sickle blood cell,
like 10 to 20 days.
10 to 20 days.
So they die a lot faster, so they have a quick depletion of them.
And so probably the body can't keep up with the demand, and so production
it's not able to at all. So production is very, very, very low, and so those cause other conditions because of that. And so sometimes we hear the term that sickle cell is a silent killer. Why would people term the disease as that? Well, you see, the thing is that it's a silent struggle.
Okay.
Yeah, it's a silent struggle. And the reason why it would be silent is because pain is subjective. So as I said, these sicklers, they're in immense pain. Now, pain, you and I will feel different types of pain.
Right.
But if you're the patient and I'm the nurse and you come to me in pain, even though you might be grimacing, I can't feel your pain. And so you find that sometimes even as healthcare workers and so forth, the empathy is not there. Yes, I may see you in pain, but I don't know how you're feeling. I don't know the level of your pain. Some might say, okay, maybe the doctor might prescribe some fluid, or they'll prescribe fluid and pain medication, but sometimes that person is really reaching out for help and the empathy is not there.
It's not there.
It comes from not just as healthcare providers, it can come from family support, the emotional support, it's not there. And so you find sometimes like sicklers, they decide to stay home. They don't come out because of their reaction that they might face from people. Also, with sickle cell now, for some reason, as I said, this is a genetic, it's inherited, right? But some persons are of the idea that sickle cell is contagious.
Oh.
Like, yes.
So that's a myth that we have to bust.
Yes,
completely.
we have to break up that myth, right? And so sometimes you may find that people will say like, oh, they disclose to their friends that, oh, they have sickle cell and, oh, don't touch me, and they have the wrong idea of it. And so people decide, okay, you know what, I'm going to struggle, I'm going to suffer in pain.
Wow. So there's a mental health aspect in terms of people are sickle cell patients, or sometimes we call them sickle cell warriors.
Correct.
Not feeling the support to be believed about their pain. I know in some instances, some sickle cell patients would even say that medical professionals they see them as drug addicts.
Correct, because they always need pain medication. And again, that's where the judgment comes from, because in my mind, I'm probably like, well, why is she always taking this medication, you know? But I can't feel her pain.
Correct.
And so I might be watching this patient like, oh, you know, maybe she just, you know, maybe she becoming addicted, which sometimes does happen. Sometimes they can become addicted, but it's really because that they can't manage without it, right?
Quality of life.
Right, and so that's where you see depression and all those stuff start to come in because you're not able to work, you're not able to function on a day-to-day basis.
Understand completely. So can you give us a little insight in terms of maybe how prevalent it is in St. Kitts and Nevis, or what do you normally see in your clinic?
Well, cause I work in the emergency room.
Okay.
Yes. So in the emergency room, maybe on an average, maybe 3 to 5. Sometimes depending on if the weather is cold, if a storm is there, it might maybe have 8 to 10 come in. I must say though, most of the sickle cell patients, they're very versed in their condition. They can tell you how it is, they can tell you what medication they take, and they can tell you exactly what triggers it. So I must say that the condition seems to be managed pretty well.
By the patients that are here in St. Kitts and Nevis. Well, that's good that they have a handle on their disease, because as a patient, well, all of us needs to take accountability for our own health, right? And sometimes we have, well, not sometimes, but all the times we should be curious and inquisitive of what is. So you should know your own self, so you could articulate what comparisons you may be feeling, because maybe this year, you know, sometimes a sickle cell patient undergoes hospitalization every month, and then maybe they now get to a place of stability where hospitalization is maybe a thing of the past.
Too much. It's too much. Nobody wants to go
hospital so many times, exactly. And just to give our audience a little bit more context in terms of the severity of the disease, and we're going to speak to where it comes from, how we would be able to get it, and so just in a bit. But sickle cell disease affects more than 4 million persons globally, and most of that is within sub-Saharan Africa, and then the Caribbean has the second highest incidence in the world. But we're gonna stick a pin, and we're gonna take a short commercial break, and we're gonna come right back. Thank you. Stay tuned, everyone.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see, and the climate's changing, but hope is remaining. And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
Hi, good evening. Welcome back, everyone, to this episode of HealthWise, where we're speaking about sickle cell disease. So just before we took a break, we were speaking about some of the sickle cell patients and the context here in St. Kitts and Nevis. Nurse was elaborating on the signs and symptoms, some of them, specifically the vaso-occlusive crises or the sickle cell crisis, which is like severe pain, right? Some of the anemia complications that could happen as a result. And then we started speaking about the manifestation of sickle cell disease. So I'd like to cue the first video, everything that we need to know about sickle cell disease. Take a look.
I found out when I was about...
While sickle cell disease is the most common inherited blood disorder, adults living with this disease still face hurdles in attaining high-quality, continuous care throughout their lives. Sickle cell disease affects all racial and ethnic groups, but Black and Hispanic populations disproportionately experience challenges with access, quality, and affordability of care. Whether it's a newborn receiving a screening for sickle cell or an adult who became eligible for Medicare, we need to understand the unique health needs of people with sickle cell to better support them and help address disparities. Sickle cell disease causes the body to produce abnormally shaped red blood cells, which fail to properly deliver oxygen to body tissues. This shape change disrupts the normal flow of red blood cells through the blood vessels, causing excruciating, acute, and chronic pain episodes. Signs and symptoms vary from person to person and may change over time. Common complications include pain episodes or crises, hand-foot syndrome, acute chest syndrome, infection, eye disease, and stroke. People may need to visit outpatient or emergency departments. Like the signs and symptoms, treatment options differ for each person and can include blood transfusions, IV therapy, and pain medications. Together, we can aim to improve the quality of care delivered to patients with sickle cell disease. Visit the CMS Office of Minority Health website to learn more about sickle cell disease and how you can begin to better serve those with this disease.
All right, so now that you have seen a little bit more information about what sickle cell is and some of the manifestations, we now want to change gears a little bit and look at some of the Caribbean context as it results to sickle cell disease. So we'll hear from Dr. Jennifer Knight-Madden, a physician scientist from Jamaica who is doing extremely wonderful work in sickle cell disease.
Sickle cell disease is extremely important to our region. Outside of West Africa, we have the highest prevalence in the world. And we got the gene not only from Africa, but also from India. So in Jamaica, for example, 1 in every 150 babies born has sickle cell disease. So this year, I'm one of the CARFA awardees, and I presented on our work in sickle cell disease, a model for collaboration. And my hope is that this model can be used in other diseases such as mental health. So, sickle cell disease can impact mental health in several ways. Believe it or not, about 6% of our children with SS disease, which is the most severe type, will have a stroke by the time they're 16. I mean a stroke. Half of your body is dead and you can't talk, right? And apart from that, 1 in 5, so 20% of children with sickle cell disease get a silent stroke, where you don't see anything on the outside, but it might affect their learning or their behavior. So clearly, sickle cell is related to mental health, but even more, sickle cell disease causes pain like you can't understand, like chikungunya times 100, right? Now imagine every morning you get up, you don't know if you're gonna go through to the rest of the end of the day without that pain. What's that gonna do to your mental health? You just don't know what's gonna happen. Thankfully, we have hydroxyurea, which can help with that. And also, if you're missing school or you're missing work, how is that gonna impact on your mental health? If your family, you feel they're getting tired of you and there's stigma, how's that going to impact on your mental health? So there are lots of ways in which sickle cell disease can impact your mental health. And there are lots of ways that public education can make sure that that impact doesn't happen.
All right, welcome back. So we would have seen that Dr. Knight-Madden spoke about the relationship between sickle cell disease and also how that could have deleterious effects on mental health, specifically depression. And I think we alluded to that earlier in terms of, not feeling that support, whether that be from the medical professionals or maybe even your family and friends. I think we live in a very insensitive culture at times, where people just say, "Oh, you're accustomed to that, just brush it off. What you talking about?" Whereas, like you said, persons can't tell me how to feel or tell me how I'm feeling because that pain is subjective, right? And so another myth that we were actually busting into is the fact that sickle cell disease is contagious. Totally false. Totally false. And so sickle cell disease is a genetic disease that is inherited from both parents.
Correct.
So if we can just cue slide 5, we'll show a little bit of information about what sickle cell is and how it is passed from parent to child. So here, just to mention quickly, this is a comparison between a sickle cell on the left and a normal red blood cell. So as nurse mentioned, the sickle cell have this crescent shape because of the abnormal hemoglobin. And now our hemoglobin is going to be abnormal due to a mutation. And that is the inherited part or the genetic part. So a mutation that is occurring in the hemoglobin gene. And this is the protein now that is going to be responsible for carrying our oxygen around the body. Right? In a normal case, those red blood cells are biconcave in shape. They are flexible. And they're flat so that they can maneuver through the very small capillaries or blood vessels. But in a sickle cell, as we mentioned, you know, they're going to have a much shorter lifespan. And also those cells are going to be sticky. So they're going to adhere to each other, other blood cells, and to the cell. So the passage of oxygen is going to be drastically impeded. So let's go to slide number 7. Where we see now how the manifestation of sickle cell is caused. So if we take a look at the top left-hand side, we're going to see a depiction of a normal cell and a sickle cell. Now, this is a depiction of what we call the DNA or the genetic code, everything that makes us us. And this is where the error comes in. So we have certain amino acids that are supposed to be giving us the building blocks of the proteins, right? But something is switched, right? I'm not going to go into all of the science and the medical jargon here, but I want you to know that from the DNA level is where we have a defect. And so as a result, now it is going to code or give instructions to make an abnormal type of hemoglobin molecule. And we remember that the hemoglobin molecule is the one that is, our protein is the one that is responsible for carrying that oxygen. So you could think about it like a limousine, right? The red blood cells are the limousines for oxygen, carrying it from point A to point B.
Throughout the body,
Correct, right? And so if we look at the right-hand side now, we want to know, well, how is it that mommy and daddy is going to make me possibly get sickle cell disease? So there are certain terms that we want to highlight. Somebody with the green that has absolutely no sickle cell traits or no sickle cell disease, right? They're totally normal. We have the term that we use alleles, so all of their genetic code is normal. And then we have a sickle cell carrier, right? They have one defective gene. And then we have somebody with sickle cell disease. So when you have two parents having the trait, and we're going to take a look at the right-hand side when we see two trait holders, both parents are carriers, there is a 25% chance that any of your children would have the full-blown disease, 50% chance that they would be a carrier or trait holder, and then another 25% chance that they would be totally normal. So it is imperative that persons know, especially if they're in a place that has high incidence of the trait, that persons know their status, whether they have sickle cell trait, whether they have the disease or not. And so let's go to slide 12. Where we see some more of the complications associated with sickle cell. So in the video that we just posted a little while ago, we saw things like stroke, skin ulcers, but this is giving us a much more detailed list of what can happen with sickle cell disease. So remember, we're talking about the passage of oxygen every single cell, tissue, organ in our bodies need oxygen.
To survive.
So correct. So if that is being impeded in a drastic way as it is in sickle cell, then you could just think about almost all of your tissues are at risk. So that is where we would have things like meningitis and stroke. And pediatric strokes is a real thing, and it is very common, right, within patients. And then you have things like skin ulcers, anemia, and all those things. So this just gives strokes, right? So this gives us a pictogram and a really good understanding of how many things could be affected by sickle cell disease, right? So nurse, can you just give me some differences in terms of what you may see at the hospital in a pediatric patient versus an adult patient? Are there any differences in their signs and symptoms?
Well, yeah, so mostly, well, for both adult and child, both of them would be, they have the anemia. And so yeah, they can have shortness of breath, the skin, it's very, very, very pale. You know, it's basically almost looks flushed. And a lot of the times when they come in, they're gasping
for air.
Right? So you have that. Also in peds, we see jaundice, which is yellowing of the skin and the eyes, and that is because you have a fast breakdown of the red blood cells. And then you also have the hand and the foot syndrome. Basically, that is where where the hands and the legs they get really, really swollen and painful, and that is because of the blockage, because of the crescent shaped.
Wow. So what's the average age that somebody could be diagnosed with sickle cell disease?
Right, so it starts from birth. So in the clinics, in the antenatal clinics, that if the person decides to go to the health centers, the nurse, she would test the mother first to see if she is a carrier, if she has the trait. But whether or not she has the trait or not, you know, you still want to ask history of, okay, how about the father? You know? So you basically get that background history from both parents, actually. And then in terms of the newborn now, with the newborn, they will test also. So they can carry out like blood tests just a couple days after birth, just to see if they have it or not. And it's very, very important that these tests are done because, you know, management is crucial.
Right.
Because when the symptoms start to show in the child, in the infant, I should say, you want to, before you start to treat other stuff, basically you might think it's another disease or so forth, when the whole time it's just been sickle cell, you know? And so early prevention, early detection, it's very, very necessary with how you're going to manage this case especially. You know,
so within our context here, if a child is now diagnosed with sickle cell disease, how is it managed?
So basically, they give the child pain medication.
Okay.
So it's like paracetamol, ibuprofen. Also, I can speak to the adults. We speak to adults more, so they would also give them the same pain medication. However, if you find that those medications aren't working, then you take it a step up. So they will probably get like an opioid, right? Something like pethidine, but those are strong. Those are last lines of medication that they would use, because those also have their own side effects. So, you know, we're just trying to trim down as much as possible.
Gotcha.
Right? So, hydration. Hydration is very important, and so they would get like IV fluids. You know, you just want to hydrate them, and so the blood, it gets very, very thick in sicklers, and so you want to try and thin it out as much as possible. Anticoagulants, basically that the same thing I was saying, to thin the blood, that is also used. And basically we just alert them, like see if they have any certain triggers, like for instance, like we tell them, keep warm, you know, make sure you're always warm. Look at certain activities, like if you play sports, you know, they're going to get tired very, very easily. So have a time limit. Not saying that they can't play sports, but, you know, have a time limit and basically the type of sport that you do, because you still want them to stay active
and have a good quality of life.
Right. You don't want to really single them out, but just with special considerations.
Understand completely.
Basically, yeah.
So we're gonna stick a pin and we're gonna come back and speak about even more treatment and even the curative factors that we have. So we'll take a short commercial break and make sure you stick and stay.
Yeah, man. Another day in the books. Well, hello there. Ooh, she pretty from head to toe, and are you ready to go? Wait there. Whew. Can't afford to slip up. Not even in my dreams.
What's up with you? Girl, you look like you're off in dreamland. Focus.
Focus. It's Valentine's season. Love is in the air.
You not here?
So Dave said he loved me and I have 24 hours to respond. I'm thinking about what I'm gonna say.
That doesn't need telling. When he say I love you, you simply say I love me too.
What's that? And who even does that?
I do.
Me too.
I love you too simply means I love me enough to make myself a priority. And it starts with making wise decisions.
This Valentine's, I choose to abstain and to protect my name.
This Valentine, I choose education now, and this is my solemn vow.
I choose to keep my virginity and maintain my dignity.
Wise choice, because saying yes to him is saying no to you. I choose self-respect over self-neglect.
Okay, I get it now. I love myself too. This Valentine, Dave can keep his love. At this point in life, I choose self-love. For learning to love oneself is the greatest love of all.
Hey baby, you know I love you, right?
I love me too.
Good evening again, everyone. Welcome back to ZAZ HealthWise. This evening we were speaking about sickle cell disease, medicine, science, and all the different nuances about sickle cell disease. So we were just talking about some of the treatment methods for sickle cell. So nurse, can you continue elaborating? I think you wanted to add a couple more things.
So they also get oxygen therapy, and that also because sometimes what happens is that the blood vessels in the lungs, as I said, the crescent shape of the sickle cell, they clump together, and so you find that sometimes the oxygen is not able to be diffused, and so they come in with a lot of shortness of breath. So we start them on some oxygen. I know when they visit the district doctors, also the private doctors, they will also prescribe them folic acid because that helps the body to produce red blood cells. And as we had mentioned before, red blood cells, they break down, they diminish very, very fast.
Quickly,
So you want to give them medication that's going to help, to produce these cells.
Understand. What about blood transfusions?
Blood transfusions is also necessary. We don't really have that problem that much here to the point where it reaches that stage.
Okay, that's lovely.
So that's good, yes, but it is necessary because of the anemia, the red blood cell count, it's usually low in that case. So, yes, so the blood bank has to be well stocked.
Well stocked,
for
yes.
Something like
okay.
This.
And we're not just typically all over. Sometimes, a well-stocked blood bank is something to be desired.
Yes,
so this is a plea for persons out there, especially if you have negative blood, universal donors blood, to donate, not just for sickle cell, but just in general, because I know there are persons who definitely would need it. We can see sometimes the clarion call a lot of the times for specific patients when they're hospitalized. So it's just something I think we could all do as a civic duty.
Just to explore,
yes,
just to explore. Because you
something
never
to consider.
know. It can be your mom, it could be your father, it
Right.
could be a best friend, It doesn't even have to be somebody, Just donating that can save someone's life.
Correct. So what about any curative factors? We spoke about the treatment, and let me just stick a pin and really outline the difference between a treatment versus a cure. When we have a treatment, it's something that is just interventive, right? And it's more in the context of maybe chronic diseases or chronic conditions, versus a cure that is going to essentially just deal with like an end-all be-all, right? And so for sickle cell disease, because it is a genetic disorder, a inherited disorder, a lot of the curative factors that just are generally there, treatment factors, maybe not available within St. Kitts and Nevis, like hydroxyurea.
Yes.
That's something that is a hallmark for sickle cell disease, because it increases what we call fetal hemoglobin production, which is a good type of hemoglobin because we have the mutation in the adult hemoglobin, and so if we could manufacture the hemoglobin
by concave shape,
yes, that would be great. But I think you was mentioning to me that we don't particularly use that as a standard of care here.
I mostly see it with cancer patients.
With cancer patients,
yes,
okay. Well, that's interesting to note, because I know in even other Caribbean islands, hydroxyurea is
the staple.
a go-to, is a staple.
Maybe persons, maybe some private physicians, they could be prescribing them, but personally I have not seen it. But then again, I work in the emergency area, and so those are more emergent, urgent cases.
Understand.
As opposed to maybe on the wards and in the health centers, no, those are more chronic. And so you will see more of the long-term medications there. In the emergent room, it's just to give the treatments to, help
to calm
that person
down whatever
in the crisis at that moment as much as possible.
Gotcha.
So,
in terms of maybe educating our audience about the curative factors such as bone marrow transplant, can you shed some light on that?
Yeah, so it's something that is new in the Caribbean, and I should say the international regions. But basically, it's like you get the bone marrow, you get a transplant. Now, remember that you have to be on a wait list because you have to find a match.
A match, right.
You have to get a donor. You have to do certain blood tests, to ensure that everything is up to par. However, it is controversial because most research says that the risk factors that come from doing it's too severe. And so you find that most persons say that they rather just treat it with the same medicine, with the same approach, the same oxygen, the same hydration and so forth, because it's like you're taking a risk, and is it really curing it? That is the avenue that we can explore also.
Yes.
But is it actually curing it? I mean, if the body now rejects it now, then you have a whole set of other complications there. So, I mean, it's everybody has their own personal choice in what they can do if they want to do it. I know there's a sickle cell disease center in Jamaica. That's the only one that I actually know about in the region. And I've seen some research that stated that they have tried it. Some successful, some unsuccessful. It just goes based on case to case to case. But I mean, as I said, the risks that come from it
can be high.
And most persons, I guess they might weigh their factors and say, well, yes, I do have sickle cell, but then would I want to now go blind and try something new, especially something that is getting any kind of transplant on a whole? It's not easy.
Right.
As I say, it's a waiting process, and so, I mean, after you waited so long and you get the bone marrow, not to mention it is extremely painful, by the way. That is very, very painful. Now, what other problem is going to be caused from this? What if my body rejects it? What if I get a stroke? What if I get an MI? These are stuff that
can happen.
Yeah. And so most persons seem to just stick with the management that they're on.
I understand completely. But to also combat the risk of rejection. So you were mentioning about a bone marrow transplant, which essentially you have to get a donor match. And that in a lot of the times takes a long time.
Yes.
But now the science has developed where you can use your own stem cells. So this is no stem cell transplantation. So it kind of eliminates, in theory, the risk of you having to reject somebody else's cells because it's your own. So a lot of the complications are reduced from that. The barrier to care now is the cost.
I was going to say that too. That's one thing I left out. The cost.
The cost and access to the physicians, the team,
the type of care that you're going to need, and those are specialists. You know, we have to outsource those. It is a fresh avenue that has been looked at, and most persons are maybe if they want to choose that avenue. But I mean, you have to have a lot of stuff in place for that, and I don't know nobody locally right now who would like to go that avenue. I guess they're scared of the unknown.
Right. But I think that is our job, you know, as scientists, medical professionals, to educate and have that real-time data to equip people, you know, with the necessary information that they would need to make an informed decision. The science also goes to things like CRISPR, and that's a little bit of a scientific jargon, but essentially it's like a biotechnological tool that helps to manipulate the DNA essentially, right? And to, instead of having that substitution that happens with the DNA that actually causes sickle cell, no, we want to change that using this biotechnology. So that is what things like CRISPR and other tech would do, biotech would do. So we're going to take a short commercial break. I think the conversation is getting a little bit exciting.
Yes.
And now we're going to have the medical spotlight, which is today Dr. Yannick Henry, our resident pediatrician. So take a look.
Dr. Yannick Henry attended medical school in Cuba from 2009 to 2016, gaining a medical degree, and spent the period from 2018 to 2021 specializing as a pediatrician. Dr. Henry describes himself as coming from humble beginnings, which gave him the motivation to achieve what he has accomplished so far. He considers himself a family man, loves youth and children, and considers his nephew Prince as his son Cyne. Outside of medicine, singing is his passion. Dr. Yannick Henry is the proud founder of the Peter Patter Pediatric Care located on Lozac Road, Bastille.
Every smile, every hug, every step our children take is a precious gift. For 50 years, vaccines have been the shield protecting those moments, saving 6 lives every minute around the world. That's 8,000 lives a day. Thanks to Vaccination Week in the Americas, 1.2 billion people have been vaccinated across more than 40 countries. In 2024, we celebrated 30 years without polio and reaffirmed our region's status as measles-free. But there's still more to do. For 2030, PAHO has set the goal of eliminating more than 30 communicable diseases. This goal is about caring for our future and for our communities, our health systems, and boosting socioeconomic progress. One of our top priorities is to become the first region in the world to eliminate cervical cancer, a disease that took more than 40,000 lives in 2022 alone in the Americas. To this end, PAHO supports countries in reaching at least 90% vaccination coverage rate for the human papillomavirus in girls under 15 years of age. Also, some countries are already vaccinating boys, which will help achieve the overall goal. But there are still children and adolescents without access to vaccines. We need urgent support from our leaders, our communities, and from each individual. No child, no one should suffer or die from a disease that we know how to prevent. Why is getting vaccinated essential? Because each person vaccinated is a life saved, a step closer to individual, family, and community development. Because your decision makes a difference. For those you love, for the future, for your health, and for the good of your country and our region.
Welcome back, everyone. So we are now going to take a look at our medical bulletin where Dr. Jensen Morton is going to give us some updates at JNF General Hospital.
Welcome to the Intensive Care Unit, or ICU, at the JNF General Hospital in St. Kitts and Nevis. This is a specialized area dedicated to the care of patients who are critically ill and require close monitoring and advanced medical support. Our ICU has 5 beds, including a dedicated isolation room for patients with infectious conditions that need to be safely contained. Here, patients suffering from life-threatening conditions such as heart attacks, severe asthma attacks, pulmonary embolisms, major trauma from motor vehicle accidents, or complications following major surgeries receive constant, high-level care. The ICU is staffed by a dedicated team, 3 anesthesiologists, 2 specialized ICU nurses, and 7 additional trained nurses, all supported by the hospital's full range of medical specialists. This team works around the clock to ensure that patients are stabilized, closely monitored, and given the best possible chance at recovery. Every beep, every monitor, and every touch of care plays a part in saving lives. This is the heartbeat of critical care in St. Kitts and Nevis.
Okay, see. All right, welcome back, everyone. So we have had a packed conversation thus far about sickle cell disease, the science about it, from a medical point of view, from nurses Anslyn's perspective, and also we really want to touch on some other nuances. The awareness, the sensitization to whether it's your school, your workplace, the communities that you live in, right? So let's take it from the kids and then go up. So if I have a child with sickle cell disease, what are some of the things that I should make known to maybe their teachers, community leaders, things like that?
Right, so you first of all you want to tell them that the condition it is not contagious.
Not contagious. Got it.
As I said, believe it or not, there's still persons in the area who are not aware of that. So you just want to tell them that this is a genetic condition. It's okay, you're not going to catch it. You don't want children are already sensitive. Right. So you don't want to make them feel scared or anything like that. So first of all, you can give them a little background information, whether it's the teacher, persons in the community, family members, just give them a little background information. You also want to look at their day-to-day lifestyle, how they eat, not things fatty or so forth, just give them a nice, clean, healthy diet. Stuff like that are high in folic acid, again, not just the tablet, but stuff that are high in folic acid. You also want to be aware, again, as we said, their triggers, right? So
such as the weather.
Children, right, and also children like to run up and down, right? And so, just to give them some little time limits, if you realize that they start panting, you tell them come back, you can go inside.
Have a drink of water.
Sip some water. You can even do board games. I'm not sure if children these days still do board games.
Is a tablet. Mommy, where's my tablet?
Right. Or you can even incorporate a game on the same tablet, if that's what's going to pique their interest. But you don't want them to be way too overstimulated, you know,
Gotcha.
because then when they start to pant and they get out of breath, you know, and then they're going to start to get scared and mommy, what's happening with me, you know? So basically you also want to do that. So. And as I said, you want to educate the public. You want to educate everybody around, you know, try to get as much awareness as possible about this disease because it's not something that should be shunned. You know, it's actually something that should be embraced because we're all uniquely different.
Right.
You know, so if persons around see that, hey, you know, the community is paying attention to my disease, and, you know, if children, they see something and they realize, okay, teacher came, even persons from the community, they can come. And, you know, they can give like just a little introduction to the topic and so forth. But, you know, in children, so you can do it in animation or so, you know. And then the children, and, you know, then the child, you have the friends and they're going to say, oh, okay, so that's what this is.
Yes.
Oh, you know, so, you know.
There isn't that negative stigma assigned to it, yeah.
You know, and also, again, one of the signs from having sickle cell is the growth. Sometimes it's stunted, right? And so they grow different. You find that they're not as defined, that they don't mature the same way. And so maybe when they reach high school, they start to really, well, I'm very, very slim. You know, I'm not getting big. I'm not as tall as my peers. And so that, you know, educating them from such a young age can show them that you are different, but there's nothing to feel bad about. You know, so you want to incorporate all of that as much into the teaching, especially for children. You know, you don't want them to become depressed or anything. And at that stage, children at those ages, you know, they're highly influenced by their peers. You know, so you want
and social media at this point.
Exactly, it plays a big part. So as I said, awareness is very, very big, very big on that.
And to also let persons know, whether a child or adult, that sickle cell, you are not defined by your sickle cell disease or any type of disease, right? You are still a fully vibrant person who can have
a full life,
functional life. I mean, there might be some complications along the way, and forums like this is what we're having to try and educate you, so you can have, you know, you could be braced with the best education and knowledge as possible for increased and better outcomes for, because at the end of the day, this is something that you're going to live with until
for the rest of your life.
You die.
That's right. Basically, in a nutshell.
Yes, not cutting any corners, but, you know, and we want to be able to extend that lifespan, because one thing that we actually didn't touch on is the mortality, the length of life.
Yes, that's true. Yes, correct.
Typically, somebody back in the 1950s, especially children, might not have lived past 5 years old in places such as Africa and maybe sometimes here in the Caribbean, because the knowledge just was not there as how it is right now, and the standard of care just was not the same, right? But now with increased scientific research and medications, access to care, right? Things became a lot better. So the median age now for sickle cell survivors would be around 45 to 50. Now, in my opinion, that is still very young.
It is young. It is young. They have their those who exceed those. They have, you know, but it's just the medium range.
Yes,
you know.
yes. So it still lends the question to at least think about the fact that, okay, if on average, it doesn't necessarily mean it's for this, because it's just an average.
Correct.
This is what my odds are. For me, if I were in that predicament, I would want to make sure that I live my life as fully and as abundantly as possible.
Not reckless. Not
recklessly, of course. But, you know, not letting this one thing that I have define my whole and total life.
Correct.
Right? And I think sometimes with the lack of support and the lack of education and all these things combined together, sometimes persons just are in a funk, and it's like, okay, well, how am I supposed to go on? Because I really don't feel like it. I don't have the energy. I don't have the support. You know, all these different things.
Finances too.
Finances is a big thing, because then the health burden and the financial burden even that comes along with having to be hospitalized sometimes 2-3 times a month, the medication, the doctor visits. I mean, it adds up.
It does, and if you're not able to work, you know.
It's really debilitating.
It is.
So even within the adult context, right? Some persons may have a very intense job. Maybe. Well, I don't want to assign gender, so let's just say let's just say the job, right? If we have a particular real high intensive job, we still have to be very mindful that that can be a trigger.
It's a high burnout.
It's a high burnout or risk for that. So, you know, you would have to alert your employer or those around you that this is something that could happen.
That's right.
You know, and it's like, no, do we have provisions within our labor force and in the society to deal with this thing and not just have the consensus that, oh, this is somebody who don't like to work, they don't show up on time, they're lazy, you know. So how do you have that conversation and want to be a professional and show up on time and do the things that you want, when you know sometimes fully you're going to be in this debilitating state where you can't even move.
You can't function.
Right? And there's the unpredictability of the whole thing, because maybe today I wake up and I'm good. And tomorrow it's just like,
I just can't do it.
What happens?
I can't get up.
Yeah, so even creating sensitization around all of those different nuances, I think, is very, very important.
Very much so.
Yeah. Is there anything else that you wanted to add in terms of like the awareness of sickle cell disease?
Yes, I personally, I just think that we should do more as a community. I think definitely it's not as prevalent as the other chronic illnesses. However, this is something that exists. I do think that it should be advertised more in terms of early detection. Early detection, it saves life, preventative care, preventative measures, and also to offer some sort of, if they find out that they have the trait or that they are full blown, you know, at least offer some counseling to these persons.
Right.
You know, because when you offer counseling, you give insights, you know, then they find their plan of care, they find their management, their treatment, and so they're able now to know what to do from what not to do, what to expect from what not to expect, right? And so when persons, no matter the age, if it's a child, an adult, if it's family, at least they can come together and make an informed decision of what they would like to do. So I would like to see more of that, more awareness for sickle cell.
More awareness,
definitely.
yeah. Sounds great. So what we'll do right now is just take a look at a patient testimonial to get some insight in terms of what really happens.
Okay, all right.
I found out when I was about 5 or 6, but I never really started to soak it in and learn about it until I was in middle school. That's when I really wanted to be like a normal kid, and I didn't have the opportunity. A lot of times, like I said, like I couldn't walk. I didn't want to be bothered. I kind of just wanted like my medicine, and then I'm like, leave me alone. Let me go through this by myself and deal with it.
When I come into the ER, I automatically have friends on. I'm just like, okay, going in here, they're gonna think I'm addicted to pain medication. How do I convince them that I'm not addicted to pain medication and I'm not just asking for it just to ask for it?
I get chronic headaches that I still get for, I think, almost a decade now that I've been having the same headache. I know the hip pains, the joint pains, and everything else, that's like a stabbing pain. I can barely move at times. I mean, I get frustrated from it. It's very frustrating because no pain medication really works for me, so the pain is there. It's not something that you can ignore, but I have to ignore it just to get the day going.
When I'm having a crisis and it's 2 a.m. in the morning, I try to have a bin of snacks like right underneath my bed, so I'll grab crackers, eat a few, try to eat them really quickly, then chase it down with some water, and then go to my drawer, which is not that far from my bed. It's like 5 feet from my bed, and then start off with something soft, which is Motrin, and see how that goes. If I'm not feeling anything within like 45 minutes, then I move on to the hard stuff like morphine, extended release or immediate release, and go from there. Usually that does it, but
if you are sick, you deserve help. If you say you're in pain, you deserve to be believed.
When I changed hospitals and I seen a girl with sickle cell, she was like just glowing, like literally. And I was talking to one of the doctors who was like, yeah, that's also my patient. And when she came in, she was just as little as you. And like, don't worry, we're gonna get you there. It's gonna take some time, but we're gonna definitely get you there.
All right, welcome back everyone. So I think you would have gotten a really good gist of how deep sickle cell disease runs within our St. Kitts Nevis context, regionally and even globally.
Correct.
Nurse Anslyn, I'd like to thank you so much for coming on the show this evening and really informing us about what it is that sickle cell is, the context in St. Kitts and Nevis, and giving some suggestions in terms of what could be done to increase the standard of care here, and also to increase even treatment therapies, and hopefully not in a next life, but in this one, where we can have the framework and the institutions for even curative avenues for sickle cell disease. But I think first and foremost, we must educate and highlight that as awareness, not just for one day. Even though World Health Sickle Cell Day is June 19th every year, and Sickle Cell Disease Awareness Month is in September, being an advocate and being able to see just how horrible the complications are.
Exactly.
Right. People go blind, people get septic, people die. So it is not something to be taken lightly just because only a handful of persons may have the full-blown disease. We have a lot of considerations to make in terms of our free movement of people.
That's right.
And we know that the persons within the Caribbean has a high incidence rate, and if they're coming to our shores and they have the trait or even the full-blown disease, we still have to take care of that burden of care, right? So we would have highlighted the medical aspect, the scientific aspect, and some of the socioeconomic aspects, and maybe we need to have another show to go into a little bit deeper dive.
A little bit deeper.
Get some testimonials from persons on the ground.
That's
right? That would be a great way to really spice things up a little bit. But in terms of imploring to our audience, our goal and mission here this evening was to really highlight what sickle cell is
and
educate about the gravity and the complications, the extensive complications of the disease, and just to implore persons to be a lot more sensitive, a lot more knowledgeable of this disease,
can improve,
and things that we could improve upon, So I think it was an amazing show.
It was.
Thank you so much again, and I'm looking forward to having you back on the show.
Part two.
Part two. All right, so you heard it here first, everyone. We're going to have a part two. So I'd like to thank everyone for tuning in this evening to ZAZ HealthWise. My name is Clilia Davis. This was our guest this evening, Nurse Cindy Anslyn. And our health tip for this evening is strong blood, stronger communities, awareness, and action are the keys. So I'd like to invite you to tune back in to our next episode next week, Monday. Make sure you stick and stay with us and be abreast on all things health in St. Kitts and Nevis. Take care and have a great night, everyone. Thank you.